if you had to pick one or two, anything that comes to mind, some of the more surprising patient outcomes or changes that you've seen? Because there are cases where I'm sure you could have predicted the outcomes. Like, I have a 50% chance this person has a 30% reduction in A, B, and C symptoms. But were there any that really stand out to you as surprising?
Well, the first one was the one that got me to decide that, yes, this happens to be my father's interest, but I'm not going to let that deter me from something I'm interested in. And it was the first patient I ever used hypnosis with. It was on my pediatrics rotation at Children's Hospital in Boston. The nurse says, Spiegel, your patient is in room 342. She's in status asthmaticus. She's been hospitalized every month for 3 months, and she's back again. And she hasn't responded to epinephrine twice, and we're going to maybe give her general anesthesia and put her on steroids. So I walk in the room, following the sound of the wheezes down the hall. Pretty 15-year-old girl, bolt upright in bed, struggling for breath, knuckles white, mother standing there crying. I didn't know what to do, but I had taken a hypnosis course. So I said, well, would you like to learn a breathing exercise? She nods. So I get her hypnotized, and then I break into a sweat, and I think, wait a minute, we haven't gotten to asthma in the course yet. So I said something very subtle and clever. I said, each breath you take will be a little deeper and a little easier. And within 5 minutes, she's lying back in bed. She's not wheezing anymore. Her mother stopped crying. Nurse runs out of the room. And if you think about the dynamic of that, I mean, it was stunning to me. I couldn't believe it, But each time she tried to breathe and had trouble, she got more and more anxious because she thinks, I'm going to not be able to breathe. It's very frightening. So you have her anxiety building like a snowball rolling downhill on top of the physical sensations. So in comes my intern. And he said, I thought he was going to pat me on the back and say, good for you, He said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. Kid you not. And Massachusetts has a lot of dumb laws, but that is not on the list. And furthermore, her mother was standing next to me when I did it. He said, well, you're going to have to stop doing this. And I said, oh, really? Why? He said, because it could be dangerous. And I said, you're going to give her general anesthesia and put her on steroids? And my talking to her is dangerous? I don't think so. So I said, tell you what, as long as she's my patient, I'm not telling her something I know isn't true. So take me off the case if you want. So he storms out of the room. He finds the chief resident and the attending, and they have a council of war. And they came back with a radical solution. They said, let's ask the patient. I don't think they'd ever thought of that before.
Breakthrough.
Breakthrough. And she said, oh, I like this. I want to keep doing this. And she was hospitalized 1 month after that, a month later, and went on to study to be a respiratory therapist. And I thought that anything that could help a patient that much, that fast, frustrate the head nurse, violate a non-existent Massachusetts law, had to be worth looking into. And I've been doing it ever since. But, the nice thing is you can see it in front of your eyes. You see whether it's going to help, just like you with your pain, it's the same thing. If it's going to happen, your brain is wired to every part of the body to make it happen quickly. And it doesn't always happen, but it often does. I'd say the next major patient that really struck me, when I first got to Stanford, I was assigned to the Palo Alto VA Medical Center. And there was an Army cook who had been mustered out of the Army because after 19 years of good service, something happened during the Tet Offensive, and he just grabbed an ambulance and some guns and ran out in the jungle and started shooting at what he thought were Viet Cong. And he seemed psychotic. They couldn't contain him. He was agitated. He was emotionally uncontrolled. He wasn't responding to meds. And he wound up being discharged from the Army and spending 11 months in a state mental hospital in California. And a social worker there, interviewed him and said, this doesn't look, he's not a drug user. He doesn't seem psychotic to me. There's something wrong, but I think it's post-traumatic. So I saw him at the VA, and he told me that something happened during the Tet Offensive, and it had something to do with a Vietnamese child that he had informally adopted. He was like the youngest of 13 children. He identified with young kids. This kid had been badly burned, was on a crutch. Nobody seemed to claim him, and so he just kind of took over, and they became buddies. And during the Tet Offensive, I find out in hypnosis, he comes upon the boy's body, and he realizes he's been killed. And in reliving this in hypnosis, and he was very hypnotizable, he says, "Oh my God, they hit G-Wing. Oh my God, they ain't got to kill kids. They ain't got to kill kids." So he's screaming and crying. And then he's going into setting up defenses on a water tower because he thinks they're going to be overrun by Viet Cong. And he's going through all of that. And I move him then. And the remarkable thing was he was very intensely involved in all this, but very malleable. So I'd say, okay, we're going to change times now. And we're going to go to the time when you collected his body and buried him. And so he does that, and he says, "Ashes to ashes and dust to dust. I guess that's it." And then he starts banging on the arm of his chair, and he says, "If I'd only taken you over to G-Wing, man, you wouldn't be there. It's all my fault." And I said, "Tell me something. Would this boy blame you for what happened?" And he starts to smile. He says, "No, no." He said, "You're number one cook. You're my number one cook. Number one cook." He knew he was going to die. He was crippled. He looked like he had arthritis. And so I said, "Okay, we're going to go to a different time. We're going to go to a time after before the funeral when you had a party for him, a happy memory." Because, often with grief, the reason it hurts so much is that you loved and cared about each other so much. So there's something positive behind the grief.
Right.
And so he says, "Oh, you look so happy. The donut dollies brought a cake, and my sister sent an electric train for a present for you. You never seen an electric train before, have you? Vietnam ain't got no railroads." And it turned out later that the train was actually from Spiegel Brothers department store in Chicago. And he said, he's so happy. "You're my number one cook." So I said, "Okay, we're going to put as much of this as you don't want to think about now behind a filter to be there if you need it. But you're going to remember two things about this. You're going to remember burying him, and you're going to remember that birthday party." And so he's sweating, he's tears going down his cheeks. And I brought him out of the hypnosis, and he looked a little sort of dazed. He looked a little confused. And I said, "What do you remember?" And he said, "Doc, I remember a grave and a cake." That was it. Grave and a cake. So it was a way of helping him acknowledge his grief, begin to go through a process of grieving, but see it from 2 points of view. That he had this time with this kid. He made the boy happy. The boy made him happy. And that can't be taken away, even though he died. And he was in the hospital for a while longer. He practiced it every day, sitting in the ward. He was doing his self-hypnosis. And he was discharged. He was upset he couldn't get back in the Army. He wanted to, but he'd been discharged. His brother, who was a police officer in Chicago, was killed in the line of duty, and he decompensated again. But we processed.
What does decompensated mean?
He got symptoms all over again.
I see.
He started to, look like he was hearing voices, although he wasn't, but, discontrol of emotion.
Mm-hmm.
And so I had him grieve his brother's death in the same way. And he got discharged. He was spending his time training teenagers how to do long distance cycling. And he was out of the hospital and doing fine. So, I thought that anything that can help people in these rather extreme situations come to a new point of view in a hurry about that was, worth pursuing. And I've been doing it ever since. And we've had people in Reveri, a guy who was in his home for 3 years. He had the social phobia, where he just couldn't stand to leave his house. He was there for 3 years, and we taught him to use self-hypnosis to deal with his anxiety. And he's out in the world again. He's living a normal life. So it is surprising how much it can help people in a hurry.